Hello everyone, welcome to Project Krishna workshop. I am Dr. Sushil Patel, consultant diabetologist from Vadodara. Today we are going to discuss about the insulin injection techniques. So why this lecture is important for the you and the type 1 diabetes children, because the type 1 diabetes children have to inject the insulin for rest of their life for management of their diabetes. So to manage their diabetes well, they have to know the correct injection technique. And because many of the time, because of the faulty injection techniques, they end up with some complication of the insulin injections, or they have some variability in the sugar level because of faulty injections. So let's see one by one how the insulin should be injected. So first is the insulin syringes, the another is the insulin pen. So insulin syringes, they are of two types, 40 units and the 100 units. So it should be ideally used as a disposable one. It should not be reuse. It should not be recap. But as they are the costly affair, we may recommend sometimes for the patients who cannot afford this pen or the syringes, and they can use it up to 6 times maximally. Or if the patient is getting pain of injection, maybe in after the 3 or 4 use, then they can replace this syringe. But maximum what is recommended is 6 times only. Otherwise, ideally it is a uh, disposable one. So what is the difference between the 100 IU syringe and the 40 IU? The 40 IU syringe contains the insulin, that is 40 units insulin per ml of concentration, and the 100 IU should be used for those insulin which are 100 units of concentration per ml of liquid. So therefore, whenever we are choosing an insulin syringes for the insulin injection, you have to first see the label on the insulin vials, that either they are the 40 IU per ml insulin or the 100 IU per ml insulin. So if there are some problems in the selecting this vial, or if you had chosen the wrong syringe for this particular insulin, so what happen if you are taking the insulin of 100 IU with a 40 units syringe, or reversely, 40 IU insulin with a 100 unit syringe? So it will give you the false insulin injection. That is, if you are using the 100 IU syringe, and if you are taking the insulin from the 40 IU per ml vial, then it will give you 2.5 times more insulin than what is purposed to be. So syringe and vial preparation, first identify whatever the insulin you want to take. Then identify the syringe. Both should be matched, either 100 IU per ml or the 40 IU per ml. Then you have to have the alcohol wipes and the disposable gloves or the sharp containers. Then wash your hands properly. If you want, then you can use the gloves after washing your hands. Clean the insulin vial. After that, you can clean the insulin site, whatever the injection site you want to be using for this particular injection. If you are using this alcohol swab for the cleaning the insulin via sites, then you have to be sure that it will first dry, and after that only you inject the insulin. Then the clean the injection site, and the injection site can be multiple. Either it can be the abdomen, it can be the upper outer arms, or it can be buttocks, or it can be upper outer thighs. Check the insulin dose prescribed in your prescription by the doctor. Remove the cap from the syringe. Straightly you can remove the cap. Then if you want to take the 20 units of insulin, then you first have to fill this syringe with the 20 units of air by pulling the plunger down to the number of units that is to be administered. Inject that air into the bottle. And after that, draw out the prescribed number of units of insulin as per the prescription. And you have to be cautious that whatever insulin preparation you are using, so if it is a premix insulin, like the human mixture, the human insulin 3070, or likewise, so these are the cloudy insulin, and you have to shake it well before you draw the insulin in the syringe. But if you are using the rapid acting insulins or the plain insulins like the human act rapid or the insulin R, or many other kind of are there, then they are the plain. pure liquid kind of insulin, and that doesn't require any kind of mixtures. So you can draw it directly. But remember one thing, that if you are using a cloudy insulin, then you have to mix it well by shaking the bottle or rolling it between the palms before drawing the insulin in the syringe. Then uh, pinch up the skin slightly with the thumbs and the fingers. Push the needle directly into the skin at 90 degree. Release the pinch, then push the plunger in up till it is going down to the zero level. Remove the needle and the dispose the syringe. So document the time, dosage, site, and the blood glucose value. So all these things are important for the injection technique. So there are the other options like the flex pens or the reusable pens are also there. Possible injection site, I had already told that abdomen. And why it is ideal, because it has a quick insulin absorption, but you can take on the upper thighs and the buttocks also, or the upper outer part of the arm also. But remember one thing is that the injection site rotation is the key in the injection therapy when they are going to use for the long period of time. Like choose the area wherever you want to inject that injection, and divide that area into the four quadrant like you can see in the figure. The third one is that select the site within the quadrant to start the injecting, and you can use one quadrant per week, or you can use each quadrant for the different injections on the same day. Inject the one figure with the away from the your last injection. That is only the key. So it should not be repeated on the daily basis on the same site. This is the only message what uh, I want to give to you. Because if you are injecting the same site the multiple time, then there may be the lipodystrophy beneath the skin. So which different injection techniques exist? So first is without the skin fold. The second is with skin fold. So without the skin fold, you can use it if the needle is 4 mm or 6 mm and directly 90 degree, or with skin fold again as shown in the figure, then you can inject directly at 90 degree. If you are using without skin fold, then even you can inject the insulin by 45 degree also. So pinching of the skin is again the important. You have to pinch the skin correctly. The pinching the skin to inject the insulin, a small pinch is enough. You should not pinch the muscle beneath the skin, or only the very small portion of the skin where the injection is difficult one. So what is the needle size you should choose? So ideally, this is a old figure, but ideally, the item, the 4 mm syringe, this needle size is again available. So children under the 12 years of age or very slim adult, you should ideally choose the 4 mm syringe. In the teenagers, 12 to 18, you can use 4 to 6 mm of the syringe. And those who are overweight, you can use up to 8 mm of the syringe in the length. In the elderly adult patient, again, depending on the build of the patient, you can use 4 mm, 6 mm, 8 mm, or even the 10 mm of the syringe for uh, this kind of particular patients. There is a different thing used in the pen is the pen needle. It has a outer protective cap, the pill foil, the inner protective cap, the cannula, and the needle bulb. So how to get the insulin pen ready for the injection? The first thing is remove the needle seal. Second is click on the needle and press the straight down with the outer protective cap. Do not click on the needle at the angle. So you should be very cautious whenever you are uh, needling the pen. Remove the outer protective cap. Pull straight to remove the outer protective cap and then save the cap. Remove the inner protective cap also. So before injecting, check the free flow of medication by priming the device according to the instruction given by the particular injection pen. So you can use by 1 or 2 unit, dial the 1 or 2 unit in the pen and then place it to the zero. So it will prime the needle, and there may be some one a single drop of the insulin coming out of the needle, and that it completes the priming of the needle. So injecting and removing the pen needle. pierce the skin, inject slowly according to your physician's instruction, slowly count up to the 10. So this is the difference. You have to count up to the 10 after the injection, injecting the needle and injecting the drugs. So replace the outer protective cap carefully, unscrew and safely dispose the used needle. Again, this is the needle which are ideally used as a disposable one, but you can use it up to 5 to 6 times if you cannot afford the needle, because they are again the costly 14 to 16 rupees per needle at current state. So valid only for the self-injection. Please note that the special instruction for employees in the health system are there. So how to avoid the problems with the insulin injection techniques? So first thing, where the patients are complaining about the painfulness of the injection. So the cause of the pain may be because of the reuse of the needle multiple times, or the needle reaches the muscle level. So recommendation is change the needle regularly, pinch the skin, and use the shorter needles. Second is insulin drips out of the injection site. That may be because of the short needle, so you can use the longer needle, or removing the needle too quickly after the injection. So insulin may have not been delivered enough or completely before you are removing the needle. So it may come out of the needle. So leave the needle in the skin longer. Count slowly 1 to 10 before removing the needle from the body. Lack of effectiveness of the insulin, unsuitable injection site, maybe lipo hypertrophy or the scar tissue. If you are injecting in such site, then there will be insulin effect will be less. Removing the needle too quickly after the injection, you will waste the insulin, so the insulin injection effectiveness may be less. Insufficient mixing of the insulin in the cartridge. If you are using the premix insulin or the cloudy insulin, and you have to mix it up well, otherwise it may give you the variable results. Or the clogged needle. Needle, if it is blocked, then the injection is not delivered. So what is the solution? Avoid the unsuitable injection site, leave the needle in the skin longer, or if you are using the premix insulin kind of thing, then you have to mix it well before each injection, and use the new needle if the needle is blocked. So dosing knob can be pressed down. So this is another problem, that I am pressing the from the back side, but it doesn't goes to the zero level. So what may be the problem? The septum of this, the top of the cartridge of the insulin may have not be pierced by the needle. So you can use a new needle, replace the needle by the new needle, and you can use it well. Insufficient needle fit. If you had fitted the needle very loose, then again that insulin may not come out. So reuse the needle, but you have to apply it very well and fix it well. And if the needle has been blocked, then you again have to reuse a new needle. So storage of the insulin in the refrigerator. The first thing is that store the product in the refrigerator and do not in the freezer. Do not store the products near the cooling element. So there are the three different compartments as you can see in the freeze. Then you can keep it in the door of the refrigerator if it is a single compartment, in between the above the bottle level and below the freezer level, and do not keep the refrigerator open for the long time. And again, if you are using this insulin or storing this insulin in your office time, then refrigerator should not be a power cut. So it should be in plug-in for the 24/7. Power backup should be maintained to ensure the product temperature is maintained. So most common issue is that either refrigerators are overloaded, so there may be some damage to the insulin if they fall down from the refrigerator. Refrigerator are switching off after the office hours, product exposed to the external environment. So these are some of the common problems what the patients may commonly encounter during their insulin injection storage sites. So right way to store the insulin, the temperature should be maintained between 2 to 8 degrees Celsius. Storage below 0 degrees Celsius may lead to product being frozen. It causes the cracking of the vial or the cartridge, and or displacement of the plunger in the cartridges. So all of which can cause the product to become inhomogeneous and non-sterile. Keep the insulin cartridge and the pens that are currently in use at the room temperature less than 30 degree. So whenever your insulin once in use, then you can use it at room temperature below 30 degree for 28 days. So risk of freezing insulin product is there, and during even the transportation, so you have to minimize that. Store in the insulated bag or the cooled thermos flask with the ice if you are suspecting that outside temperature is more than 30 degrees. Insulin should not be kept in the locked car with the closed window because again it will be heated up and it will goes above 50 degree maybe sometimes. While traveling by air, insulin should not be placed in the check-in baggage to avoid the exposure to the extreme temperature, particularly the mostly freezing temperature. So insulin should be stored between 2 to 8 degrees Celsius, and when in use, it can be kept at room temperature less than 30 degree for 28 degrees Celsius. So right way to store the insulin, if there is a humidity outside, then there is no special requirement. If there is a bright sunlight outside or the strong artificial light, then you should protect the insulin from direct sunlight. Wet condition, again, you have to protect the insulin products from the wet conditions like the rain or the snow. And the dry ice, if you are using for storage of insulin, then never sand or keep the insulin product together with the dry ice. Should be some barrier between the dry ice and the insulin. So some simple tips like do not store your insulin near the extreme heat or the extreme cold. Never store insulin in the freezer or the direct sunlight or in the closed compartment of the car. Check the expiry date before using the insulin. Don't use any insulin beyond the expiry date. Examine the bottle closely to make sure that insulin looks normal before you draw the insulin into the syringe. If you are using the regular insulin, then if you are using the regular insulin, then check for the particles or the discoloration of the insulin. If you are finding it some doubtful, then you have to discard that insulin. If you are using the NPH or the lente insulin, check for the frosting or the crystals in the insulin on the inside of the bottle or for the small particles or clumps in the insulin. If you find any of these in your insulin, do not use it and return the unopened bottle to the pharmacy for the exchange or for the refund, and you can use the newer insulin. So these are some of the tips for the insulin injection technique. Ideally, that all should be uh, counseled to the patient's relative, variable either by the doctor, either by the diabetes educator, or either by the counselor. All these things are important in the life of type 1 diabetes patients. So if they are injecting the insulin properly, they will not feel it the burdensome because it will go as a painless injection. Second thing that it will not going to cause any complication if they are rotating the site, if they are storing the insulin at the correct temperature, then the insulin injection will be as effective as it should be. Otherwise, if the storage is not proper, then the effectiveness or the efficacy may be variable. So thank you again. Thank you very much for kind listening. If you have any question, then you can ask in the chat box. Thank you.